Hi, good evening. Welcome to this evening's Össur webinar on the new Unloaded 1X. My name is Stewart Hogg. I'm the National Sales Manager for the Bracing Sports team in the UK, ably assisted by my colleague Peter Gill.
Good evening, everyone.
The account managers for North East and South Yorkshire, but also one of the founding fathers of the Össur webinar format. So an interactive session this evening, we're going to go through the Unloaded 1X, talk about the project and also the transition between the Unloaded 1 Smart Dosing and the Unloaded 1X. This can't happen just by me, although we pretend that it does. We're ably assisted by our colleague Maxine Hickson, who will be working on chat and also on the cameras, and also Anya Roberts, who will be working on the roaming camera for some up close on the brace. And after the presentation, Peter will go through an in-depth fitting of the product on myself, and then we shall get going with the presentation. So I hope you enjoy it, and it should be an interactive for yourselves. So we can go to presentation. Just to go through some housekeeping and how to communicate with us. So please feel free to type any questions you have through the Q&A function at the bottom, or also the chat. Which then can be followed up at ossur.co.uk/webinar. So that allows you to go to the webinar at a later date and you can look at it. There will be follow-up questionnaires sent out to you through your email, and also we'll send you out some e-certificates for your attendance for the Unloaded 1X webinar. So just to give you a bit of background about Össur, just in case you're not familiar with us, we're an Icelandic company with our headquarters in Reykjavik. We do have sites strategically located throughout the world, with main offices in Foothill Ranch in California and also Eindhoven in the Netherlands, for a lot of the research and development comes from. But as you can see, we're strategically located offices throughout the world, from Canada all the way down to Australia. And as the company has grown, we started off in the early 70s as a prosthetics company. But as you can see, where we are now, we're pretty much 50-50 between prosthetics and bracing supports. Dealing with mechanical and bionic products on the prosthetic side for lower limb, but also upper extremity amputation. Myself, Pete, Maxine, Anya, the people you saw at the start, we all work in the bracing and support side, focusing on injury solutions and also OA solutions. So the Unloaded 1X is the newest product to our OA solutions portfolio. But we do a full range of bracing and supports for the knee, starting at post-surgical within the rebound and post-op knee. We also have the functional healing range. Most prominent are rebound PCL and rebound ACL. We then have our protection range under the brand CTI. It's a prophylactic ligament brace, which is used for dirt bike market, skiers, and also post-surgery. We then have knee supports with the FormFit range and the FormFit Pro range, which you can see there. And it's a kind of value compressive sleeve type products for the knee, but also for foot and ankle and hand. And then we go to our OA portfolio, which is from mild to moderate OA, up to moderate to severe, with the Unloaded 1 Lite and the Unloaded 1 range, which will include the Unloaded 1X. So what does the brace actually do? So what we're looking to do is look at arthritic knee, whether it be medial or lateral. We're trying to offload that area which is affected by osteoarthritis. And what we're looking to do is minimise the pain on the affected joint. And essentially what the brace is doing is redistributing the load from an area that is unable to tolerate the weight to an area which can. As you can see on the diagram, the way we do that is by a 3-point pressure system. The straps above and below the joint line, putting the force through the knee on the muscle, rather than historically what would have been done in bracing would have been a bony prominence. And what we're trying to do with bracing is basically create a solution for a biomechanical problem. And the outcomes of that are pain relief, increased quality of life, increased activity levels, delay surgery, and also reduce medication use. So that's the main things that we're looking at. But essentially, it's a pain-relieving device that we're looking to get to the patient. And the indications have grown throughout the years. Initially, it was looked at for unicompartmental knee osteoarthritis. But as you can see on the screen, unicompartmental knee conditions require load reduction, so it's fixed compartment. And they can include degenerative meniscus, meniscal cartilage repair, articular cartilage defects, tibial plateau fractures. It can also be used within the surgeries field for preoperative assessment for HTOs, but also for preoperative assessment for unicompartmental knee arthroplasty. And not to forget that the Unloaded 1 is recommended, or bracing and supports was recommended within the NICE guidelines, which was last published in 2014. And they stated that people with osteoarthritis or biomechanical joint pain or instability should be considered for assessment for bracing, joint supports, insoles as an adjunct to their core treatment, which does include education, advice, strengthening, physio, weight loss. So this is an adjunct to their core treatment. So the evolution of the brace, I'm pretty sure everybody on tonight's webinar is familiar with the unloader. It has been around since 1986, so it's 33 years old, gone from quite a beige, old-looking thing, shall we say, but the most recent version in 2019 is an evolution from something that started 33 years ago. As you can see on the left, it's a hard carbon fibre brace with one DFS strap. In 2006, we launched the Unloader 1 Original, which looks at lower profile frames and a dynamic force strap, which was able to be changed by the patient. Then that evolved into the Unloader 1 Smart Dosing, which you know today. And then where we are in 2019, we've launched the Unloader 1X, which launched to the private market in October, with a pre-launch and then a launch in the NHS in January of 2020. So what the engineers looked at and what we looked at as a company was building on the existing strengths of the Unloader 1. Dynamic force straps being key, the 3-point leverage system, which is something that we have with the dynamic force straps. The smart dosing, so that the patient is able to control the level of force which is going through the brace. Materials which are used from the Sensile and dosekin liners, and also the adaptability aspect of the shell itself, so that it can contour and fit to many different leg shapes, and also the durability of the product. We have studies to show that people are wearing this brace 8 years after initial fit. So where we've gone from is the Unloader 1 Smart Dosing, which you'll be familiar with. Most people on the call have fitted one before. And what they've looked at and what we've done is created the Unloader 1X, which you can see on your screen. I'm just going to talk you through some of the key features of the Unloader 1X, which they looked at to improve the aesthetics, ease of use, and also the comfort of the product. The biomechanical aspect of it, they tried to keep exactly the same. That was the blueprint of the brace, is to make sure that the straps and the way that it offloads remains exactly the same. They're just trying to make it a more usable product through comfort. We can make it look a bit better, and also the ease of use for both the patient and also the clinician. So that looks at the overview of the background and the opportunities for improvement. So I'll talk you through ease of use, talk you through the comfort, and talk you through the aesthetics and what's changed within those 3 areas. So with the ease of use, they looked at intuitive donning. They looked at a position guide so that the position of the brace can be fitted correctly onto the leg, with the Össur sign in line with the top of the patella. The yellow user touch points, which we'll show in a second. The brace has highlighted yellow touch points throughout the whole brace so the patient knows where they can and cannot touch. There's colour-coded buckles and strap sealing, which is the internal side of the straps show that the straps are in the correct position. One of the biggest things we're getting from the feedback is the fact that the brace is completely machine washable. The brace comes with a bag, you pop it in there, you can stick it in the washing machine at 30 degrees, your towels or your smalls, and then bring it out and air dry it. You don't have to take anything off the brace, you put the whole brace into the bag. The brace is completely field serviceable, so everything on the brace can be changed, and from liners to straps to velcros, even the integrated BOA system can be changed on the brace. So we're looking to keep the initial frame and get the longevity of the product as long as possible. We look at the patient group that we're selling or using the product, and we looked at dexterity issues. So using that BOA dial to increase and decrease the level of force, we integrated as an accessory the sun dial, which widens the surface area and can be easily changed by the patient rather than having to use a slightly smaller BOA dial. And there's also finger loops which can attach to the buckles, which makes it easier for the patient to don and doff the brace. We also looked at stockroom friendliness, so the box is 25% smaller than the standard box, and also 50% smaller than the Unloader 1 XL, which makes it easier for inventory, but also reduces the carbon footprint in terms of the amount that we can ship out at any one time. We can just move to the roaming cam. I'll show you some of those key features. So you can see that the yellow touch points in the brace are highlighted here in the buckle, highlighted in the BOA, highlighted in the hinge, and also highlighted in the lower buckle. The positioning guide is the Össur sign, which essentially is to be fitted right in line with the top of the patella, but we'll talk about that when we go into the actual workshop. And that's the main parts in terms of actually ease of use. All the other stuff, machine washable, and the dexterity tissues or accessories in the stop wound friendliness. So we can move back to the presentation. We can then move on to the comfort. So one of the biggest things with bracing is to reduce the ability or reduce the chance of the brace migrating. So what we did was look at the calf strap angle. So you can see that on the left-hand side, on the smart dosing, it was quite a low calf strap angle. So what they've done on the Unload-O-1X is increase that angle so that the strap sits right at the back and cups over the top of the gastroc band. And what that does is essentially minimise the risk of any migration. They've also changed the anatomical pin bend by about 5 degrees. What they showed in testing that was with that slight anatomical pinch bend, when the knee's in flexion, the brace sits more comfortably on the leg. And also the shell rigidity. The Unload-O-1 smart dosing is flexible, but they've made the new brace even more less rigid so that it contours better to many different leg shapes. One of the biggest one was the minimising the risk of pressure points. And the way that the brace is made is now injected moulded. So the calf and thigh frame sections are injected moulding, and they're over moulded in all the hinge arms. You can see on the picture there, on the right darker grey one, the Unload-O-1X, it's actually over moulded into the frame. Unload-O-1 smart dosing is riveted on, which gives you the potential for some pressure areas. In fact, the way that it's injected moulding means that all the calf and the thigh sections don't have any prominent areas, which completely reduces the risk of any pressure points. There's increased breathability, so we now have open cell foam liners, which allow us to put it in the washing machine. And those little holes, the engineers like to call them slender shape perforation. Instead of having the lines in the Unload-O-1 smart dosing, they now have slender shape perforations. Very much engineering talk, but that's what it's called. One of the biggest differences is the progressive resistance. So the dynamic force straps, or the DFS straps, are now over moulded with a rubberized section. What that means is that when the knee is in 20 degrees of flexion to full extension, the Unload-O-1 smart dosing is essentially on or off. With the new Unload-O-1X, there is a progressive resistance. So as they reach that 20 degrees of flexion to full extension, there is a more progressive feeling to the patient offloading rather than an on-off feeling. So from a patient experience, it's a lot nicer for the patient. Reduction of popliteal discomfort. So the positioning or the fitting of the DFS strap, instead of being done posteriorly, which we'll show you in the fitting, is actually now done anteriorly, facing the patient. It means we're just reducing the risk of any bulk at the back of the knee. They've completely redesigned the popliteal pad, so laminated doe-skin, so a lot softer and a lot easier to adjust, which again we'll show you in the workshop. And the soft, invisible single seam straps. When you meet an engineer who designs a strap, you go through about 35 different iterations of a strap. And what they've managed to do with the one which is on the Unload-O-1X is something which is 50% thinner. It's stronger because of internal webbing, but because of that single seam, a lot softer on the skin. So the potential for any skin irritation has been greatly reduced. One of the things we're also proud of is putting all those functions into something which is 100 grams lighter than the Unload-O-1 smart dosing. So 460 grams for the Unload-O-1 smart dosing, Unload-O-1X 360 grams, which just makes the feeling for the patient a lot more accepting of the brace rather than having what you can see as a heavy product. And also concentrating on skin protection. So for your larger patients, there's extension doe-skin liners which you can wrap over the top to give a larger surface area for the calf and for the thigh, sorry. There's ActiGrip calf liners instead of silicone, in case it's too tacky for someone's skin or someone who has hair follicles which are quite thick or papery skin. They can have an active grip liner. But there's also the option for doe-skin liner, which knocks it back again in terms of the grip of it. But with that new gastroc strap sitting over the top of it, it greatly reduces the risk of any potential migration. So we just flip to the roaming cam. We can clearly see that the difference in terms of the strap is 50% thinner and wraps over the back at the top of the gastroc, which gives you a nice anchor point, compared to the Unload-O-1 smart dosing, where the strap is quite thick. Also, we've lost a little ledge, which people did have a tendency to forget, to stop that section sliding down. On the back section here, if anyone's fitted one, we would actually be changing the strap tension at the back of the knee. This is all now done anteriorly, which we'll talk about through the workshop. And this new popliteal pad, which we'll show you, but it's set in position. So we know that we're reducing the risk of any extra bulk behind the popliteal area. And as you can see on the shell rigidity, it's a lot lower profile. What they've made sure is that every single point of connection for biomechanicals is exactly the same. They just tried to reduce the risk in terms of surface area. This section here wraps around the leg a lot larger than this one. It's more strap than shell, which means it contours to the leg a lot nicer. We can flip back to the presentation. Thank you, Max. And also aesthetics. What we're trying to do is get acceptance of this product. You can see that the grey design of the old one is particularly medical. They've gone for a low profile design, which is aesthetically pleasing, but also talking about those sleeker shells. You see on the diagram, as the brace gets bigger, the strap that comes around the thigh section gets larger. What they've done with the Untitled 1X is keep it a similar size for all legs and able to cut the different shape through the straps. Again, minimising the area. You can see that's highlighted over the old Untitled 1s, and to keep those touch points exactly the same, so the biomechanical force can be applied the same as it can be on an Untitled 1 smart dosing. But also the integrated smart dosing with the BOA system is actually included into the frame rather than being on the strap. So you've got a lot more area, a lot more lower profile area at the front of the knee. And we hope the compliance and acceptance of the product will be higher with the charcoal grey colour, the brushed aluminium hinge caps and hinge arms, and the subtle branding on the brace, making it look more like a lifestyle product rather than a medical device. There's some quick technical specifications for you. A couple of main points. If anyone's above 5'4", we recommend the standard. Anyone below 5'4", we recommend the short version. Basically what this means is the hinge is cut by around about 1 centimetre. One thing to be aware of, it is machine washable, but do not bleach, iron or dry clean the product, although I think your warranty might be revoked. Whoever would die on a brace, I don't know, but anyway. And also the warranty on the frame and the hinge is 2 years and the soft goods is 6 months. And the sizing remains the same and the measurement remains the same. So it's your circumferential measurement, 15 centimetres below mid-patella. That then corresponds into an extra small up to an extra large. And then remember, you still have your right, left, medial or lateral. So we still have 16 different iterations of the brace, the same as you would have with the Untitled 1 smart dosing. So clinically, the brace is the same. We've looked at, as I said, ease of use, comfort and aesthetics. And I think they've done a really good job on that. There's really 12 key points that have made a massive difference, both for the clinician, but also for the patient experience. We're also now talking about AXA, indications in the pathways. So since 2008 of last year, Össur and AXA have been working closely together. And AXA now offer this product as part of their conservative management. So when they started in August 2018, it was for one condition. It was for unicompartmental osteoarthritis, and it had to be recommended by an orthopaedic consultant. Now that's been successful, but when a patient meets an orthopaedic consultant, it's usually at the back end of their treatment cycle. So with the success of the relationship with AXA and the patients that have been funded by AXA, we had a discussion a couple of weeks ago, and we're able to say now that we continue with the consultant pathway, but also introduce a new physio pathway. And in the middle, there's now new indications recognised by AXA. And what that means is that any condition that requires offloading of the medial or lateral compartment, if it's clinically validated and you feel as a clinician this is beneficial to the patient, AXA will now fund the brace. Also for OA, but also for some of the indications on there. If you can't see them on the screen, we will send out this pathway to you on your e-certificate so you can look at it in a bit more detail. On the blue section and the blue circles at the top, that's the standard consultant pathway. Patient phones the GP and gets triaged via physio with an AXA. At that point, referred to an orthopaedic consultant through their AXA PPP insurance. Consultant recommends the Untitled 1 as a treatment, and the patient will then contact AXA, be given an authorization code, they'll contact us, and we'll send them out to essentially you guys, where they're trained to be fitted within our fitting centres. As of now, with the patient, which is what they do before they see a consultant on the most part, is the patient will be triaged by AXA for physio treatment. They'll be given 6 to 8 physio sessions. Physio can treat them through those 6 to 8. At the point of that, 6 sessions, say, as a kind of minimum or maximum, they can now recommend or think of the Untitled 1 as a treatment option for them. What that patient will do is phone AXA, and what they're called is the specialist physio team, based in Glasgow and also in Bristol. They can then speak to those clinicians who are essentially band 7, band 8 physios. They can authorise MRI and X-rays. They can look at it for their own clinical decision with help from yourselves and determine whether or not an unloaded one would be suitable. At that point, they can give an authorisation code to the patient, and the patient would continue to contact Össur, of which then we would redirect them to one of the fitting centres, which includes you guys on the line. Again, any questions on that one? We will send that out, but we can take questions, or you can type any questions to Maxine, she'll be happy to answer them. The one thing to be aware of is that as of next year, in April 2020, all medical companies within our field and others have to abide by the Medical Device Regulations 2020. Basically what that means is that any claim, medically or clinically, have to be backed up by fact. So you may be familiar with some of the marketing material that we have. This all has to be signed off by a medical office. We can't make wild claims. It all has to be backed up by fact. So for pain relief for patients with NEOA, the functional improvements, the high related quality of life improvements, patients with symptomatic DJ meniscus tears, reduction of unit complemental load, the improvement of quality of life for patients with NEOA, the cost effectiveness of it for treatment of patients with the NEOA, and can delay surgery for NEOA. These are all taken directly from trials which have been carried out here in the UK, but also in other countries around the world. I won't bore you with all the facts and figures, but all the research is there. Maxine is going to put the link on the chat function, which will allow you to go straight to our website if you are wish to read it in any more detail. If you need any more information, please contact us and we can send it over to you if you want to look at that in a bit more detail. At this point, as an introduction to us, an introduction to the AXA and the indications, and a little bit more about the pathway which is being developed. If you do have any questions on the presentation now, I'd be happy to answer them. Maxine, do we have any questions? Hope you're all still awake out there. So instead of PowerPoint, I'm now going to pass you to my colleague, Peter Gill, who's going to run through the fitting of the Unloader 1X, which is in some cases slightly different from the Unloader 1 Smart Dosing to get the optimal levels of performance from the brace. So I'll pass you over to Peter.
Thank you, Stuart. Hopefully you can all hear me nice and clear. You're going from a Glaswegian accent now to a Yorkshire accent, so I hope you can keep up with us. But while Stewart is just dropping his trousers and popping on a pair of shorts behind Anya, I'm just going to talk you through what you get out of the box. So first of all, we obviously get a patient guide with this. It's very important that when you're training, when you're fitting these to patients, that you also educate them how to fit it, because you're only there for that first fitting. But one thing that I want to stress, and you'll probably know this if you've fitted these before, is that we have a guidelines of how much we actually want the patient to wear it. So for the first week, we want 2 hours per week. Second week, 4 hours per week. And by the third week, 6 to 8 hours per day is fine. It's just like a new pair of walking boots, ultimately. We don't want them to go trekking for miles in a brand new brace. The other thing that we get out of it, as Stuart has already mentioned, we're all very excited about this, a wash bag. So put the whole brace in there and it will get it really, really clean. As you can imagine, we've been fitting braces for many years now, and the first question that patients often ask us is, how do we keep it clean? So that's great for us. Obviously, we get an IFU in the box as well, but who reads instructions? That's why you're here tonight. And then we obviously get the brace. Okay, Stuart has seamlessly slotted into position, and he's got his legs out there. So, so first of all, then, obviously we get the brace. In terms of what we want to go through before we start fitting this is, if you can zoom in here, Anya, we just want to make sure that the tension's set correct. So if you can just zoom in here, you can just see that we want that yellow bit showing just in here, and on both the bottom and the top straps. Okay, so we've got that. And subtle differences really, while going through this, I want to hopefully show you that we've made it much easier to fit for both the fitter, but also for the patient, that we've made it comfier for the patient, and then also it looks a lot better. So if you want to come in a little bit, Anya, we're now going to go through the fitting, and we're going to focus first on hinge positioning. So we want the patient to kind of sit at the end of their, at the edge of their chair with their legs slightly flexed. And that's the first change. Previously, we would say that patients should have their leg in extension. The other thing that that's new with the Unloader X is that we've got this branding here. So if I zoom in there, you can see that there is an Össur logo, and you can see that it's actually raised there in the middle. What we want to do is we want to get that in position so that that Össur logo is lined up with the top of the patella. Okay, And that's really the position that we want. And it's always good to educate patients on this one. Hinge position is key. But also from where I'm looking at, it's very easy to see where that Össur logo lined up. But from a patient's viewpoint, they're coming from a different angle. So always make sure that that's in a good position. And then the other landmark that the other aim is that we want the front of the hinge to be in line with the midline of the leg, really. So in terms of front to back, we want that hinge, the front of that hinge to be lined with the midline. Hopefully you can see that nice and clear. Okay, so once we've got the hinge position right, the first thing that we're going to do is, similarly to the old unloader, is we're going to connect that blue to blue there at the bottom. But like Stewart has already said when he was going through the product, there is no ridge anymore that we have to sit that on. So we just slot that into position and then we clip the brace. Okay. Now, if Stewart can just swing his leg to the right, we've clipped that in. And then in terms of how we do the gastroc strap or the calf strap, it's obviously just a Velcro, but we want this pretty tight as it's going to be the main anchoring of the brace. But often a good technique is if we just hook that up to make sure that it sits over the gastroc, you can see that that position is really fits really well to Stewart's leg. Okay, Stewart, if you can bring back to the front. Okay, and then the next part that we're going to do now is we're going to connect the yellow to yellow. So if you zoom in, this is very similar to the old one, and then we just clip that into place. And again, we're clipping the clip in place there. And the function here is exactly the same. Swing your leg to the round to the side. And we're wanting to get this nice and tight here. What's really important though, is that we get these Velcro the Velcro parts here really in line with the strap. So that we're making sure that none of the hooks are overhanging onto the patient's skin. It can scratch the patient's skin and make it a little bit more uncomfortable. So make sure you're quite accurate with that. In terms of tension, it's more important to get that calf strap tighter than the thigh strap. This is really our main aim of where we're suspending the brace to stop the brace from migrating. So try and focus on getting this one nice and tight. And then sometimes with the amount of muscle bulk that we have in the thigh, it's just a tad bit looser often works quite well for the patient. Okay, so if we swing back round to the front, and we're just going to check that hinge positioning now. So at the minute, what I always get my patients to do when we're fitting these is before we even look at the DFS straps, we actually get the patient to just stretch their leg, extend and flex their leg. And what we're doing in this and what we're looking for is that hinge positioning. So if you can zoom in here, Anya, to the actual hinge, that's not bowing out and it's staying in line with Stewart's leg really nicely. If it was fitted too far back, so too posterior, it would be angled in a way that when Stewart flexes his knee, it would bend outwards, so it would push out that way. And if the opposing happened and it was too anterior and it was wrapped in this kind of angle, then it would, as Stewart flexed his knee, it would squeeze in. So always do this when first fitting. It's a really good way of just making sure that you're happy with the brace fitting. Okay, so how have we changed this? So we've obviously improved, made it easier to fit for both the fitters and also for the patient. So in the past, what we would do at this stage with the smart dosing unloader, we would stand the patient up, we would turn them around, and then we would be fiddling with the straps around the back. Now that wasn't only uncomfortable for the patient, but it was also uncomfortable for the fitter, especially if they've got horrible boxer shorts on or anything like that. So we've made it much nicer. We can now do the whole fitting from the anterior, from the front, basically. So if you can zoom back in, Anya, for me, I'll show you how we do this. So again, as out of the box as we started with, we're making sure that the starting point for this is just showing a little bit of that yellow in the bottom component and a little bit of yellow in that top component, the thigh component there. Okay, and then we're going to get the patient to extend their leg, please. Perfect. Now this is tricky. It's a subtle difference to how the old brace was fitted, but the best way of doing it is you can see here we've got an alligator clip there at the top, and what we need to do is we basically need to apply a tension to the brace so that it contours the leg, and then we're feeding that Velcro, the strap into those alligator clips there, and then we're closing it. Okay. Now, obviously, this is flapping at the minute. This is for the trial fitting. Once we're happy with the brace and we're happy with the fitting, we will trim this, and I'll show you how to do that shortly. Okay, and then we're going to do exactly the same with the bottom component. So we're going to apply a bit of tension to the strap so it's contouring. Hopefully, you can see that nice and clear. and then I'm just going to fold that into there and then close that back. Okay, so in terms of fitting now, we're pretty much there, and I'm just going to tighten the DFS strap. So Stuart, if you can flex your knee, please. And now, Anya, you can zoom into the BOA dials. So what we're aiming for now is we're aiming to bring this dial in here to that central circle. Okay, right in the middle there. And then we're going to do the same with the top one. You can get a good view of Stuart there. I'll block him with my arm. Okay, and at this point, we've dosed this up, and we're going to check the tension of the DFS straps now. So hopefully, we're going to be happy with that. But Stuart, if you can stand up for me now, that would be great. Thank you. Okay. So in terms of how tight you want these, it's a very difficult thing, and this is an arbitrary scale, so it depends on how strong the patient is, but it also depends on how tight you tied these DFS straps in the first instance. But what are we aiming for? Well, we're aiming to make sure that the patient can fully extend their leg. If they have a feeling that the brace is pushing them into flexion, then it's too tight. The other thing that we're looking for, if you want to zoom in, Anya, to my finger, we just want to be able to get our fingertips underneath the straps. So it's a good test just to do that. And I think that this is not a bad fit, actually, on Stewart, okay? If we felt like it was a little bit too tight, then we would just use the BOA dials, and we would just take a little bit of tension off there, but we wouldn't need to take much off. Equally, if we needed to make it a little bit tighter, we would increase that. So Stewart, if you can sit back down for me. I'm going to touch upon another way in which we've made this much easier for patients to fit. So previously, what we would have to do is we would get the patient to undose these straps here and here to take the tension out of it, and then they would unclip the two clips to then take the brace off. But with the new setup of the straps, the patient can now just unclip these, and they don't have to take any of the tension out of the brace. So Stewart, if you can take that brace off for me. And what I'm then going to do is I'm going to cut the straps so that it looks nice and tidy for the patient. Okay. So at this point, if you can zoom in here, hopefully you can see this. So I'm going to take the tension out of these by pulling it, and you can just see that that yellow marker is moving out. And now we've got visibility of these alligator strips, of the alligator clips there. I'm going to disengage that, but I'm going to make sure that I keep this fold in there so that I can I know that I'm cutting it in the right place. Okay, so you can see that I've kept that fold. And now what I'm going to do is I'm just going to take some scissors and I'm going to cut this straight down the middle. Okay, that fold is still there. Hopefully you can see that. And we're just going to cut through there. This is a bit where you get a bit scared. You hope that you've cut the right bit and not cut the wrong bit. Okay, so you now see that I've cut that, and that then just seamlessly fits into that alligator clip there. And again, we're making sure that all of the hooks engage with the strap. Okay, we're now going to do exactly the same with the top bit. So we're disengaging so we can see all of the alligator clips. Okay, we're then opening this up, making sure that that fold remains in the same place. And again, we're going to take the scissors and cut that down the middle. Okay, looks good. Doesn't look like I've cut too much off or the wrong bit. And then we're going to engage that back in there, making sure we've got a good connection with the Velcro, and then that top bit goes over. Okay, now I'm going to, because the fitting was pretty good, I'm going to redose these to 5 into that central hole, and this one. And now we're going to ask Stewart to fit this back to himself. So Anya, if you can go over the top so we get a bit closer, we can see. So we're making sure that that Össur logo is in line with the top of the patella. We're not having to take all of the tension out of the smart dosing straps. They're going to remain in the tension that I've set it up as a fitter. We're going to go blue to blue, and hopefully that we can get that in. And then close that from the back. Push the hinges in position. Make sure the hinge is a bit further back, Stuart. Perfect. And then we're going to bring that yellow to yellow. And hopefully, if Stewart stands up for us now, that tension should be pretty similar. I think we've just got the hinges not in an ideal position there, but I think that's a little bit better. And now you can see that that's fitted, gone back onto to Stewart really easily. Now, another part of the brace where we've improved the fitting and made it a bit easier, and now this is the only part of the fitting which we need to do from behind. If Stewart can turn around for us. So the popliteal pad and this area was always a bit of a challenge for us actually. In the past with the smart dosing, we would sometimes have straps that overlapped here. So the patient really felt the bulk in that back of the leg. What we've now done is to manage the popliteal area. We have this new pad where if you pop your index fingers in there, it disengages the Velcro. Ask the patient to flex their knee slightly, it relaxes the straps, and then we can center this in a position which we're happy with. So if I just show you, I can move that really freely, and then I can just center that, making sure that there's no creases or any folds, and it's contouring to the patient. And that's the only part of the fitting process now that needs to occur from behind. So the brace is now fitted to Stewart. If Anu, you want to have a little stand for us, you're going to walk back to the room a little bit, and Stewart's just going to walk towards the camera so you can hopefully see that the brace is nice and contoured and really low profile. So the hinge isn't sticking throughout, but the hinge does sit a little bit higher than on the old smart dosing, so don't worry about that too much. I think one of the biggest changes, especially from patients who I've fitted these to so far, is that feeling in the back of the popliteal. So patients would often flex their knee and they would say, oh, I can feel quite a lot of bulk in the back of my knee, but with the new ones, you could go into a deep squat or really flex your knee quite extremely, and you just don't feel the same amount of bulk in the back of the popliteal. So we've vastly improved it as a brace. Hopefully I've shown you there how we've made it easy to fit and how we've made it easy for patients to fit. If you've got any more questions on that, please do pop them into the chat function, or if you've got any questions about what Stewart talked about earlier, then we're going to stay online for the kind of next 5-10 minutes and hang about and make sure we get any of those answered. Okay, but thank you for attending tonight, and I hope that's been useful.
See you later.